Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Pho, founder and editor of KevinMD. Today on the show, we have Thomas Pack and Mattie Renn. They are medical students and they co-wrote the KevinMD article, The Mental Health Jeopardy of Our Youngest Healers. Mattie and Thomas, welcome to the show.
Thank you so much for having us. It's really an awesome opportunity to spend some time with you.
So we'll get into your article in a little bit, but first off, I'm going to ask each of you to share your story and your journey. Thomas, if you go first.
So I'm repping Iowa. I grew up in Des Moines, Iowa. I went to Baltimore for college, and then I came back to the University of Iowa to be trained as a physician scientist. And my story about getting into advocacy, getting into student wellness really is a common story. And that story is that of a burnout. I was fixated with trying to do well in class. I was comparing myself to others, spent long nights, worked weekends, and I really didn't take time for myself. And by the second year, I realized, I just burned out and had this issue where I couldn't go on. And to me, that served as a realization that there are a lot of issues in our medical education system that contribute to this burnout, and I wanted to change that.
All right, and we'll get into those issues later on in the podcast. Mattie, if you could share your story and journey to where you're at today.
Yeah, absolutely. So I am originally an East Coaster. I went to undergrad out in Chicago, where I got a BA in cellular and molecular biology and a minor in human rights. And then I came back to the East Coast to New York City to pursue my MD. So I'm currently in Manhattan, and I'm a medical student normally at Columbia University in New York City. But this year, I'm actually taking the year off, and I'm working at the American Medical Student Association, which is actually where I met Thomas, as the KP Education and Advocacy Fellow. So I'm spending my year working on medical education reform and advocacy and political advocacy. In terms of sort of my journey into having conversations around mental health and advocating for the mental health of medical students and trainees, I grew up in a family where mental health was a big issue. So I knew going into medical school that I wanted to make sure that I was advocating for mental health rights and mental health access. And then basically just found my way into a couple of leadership positions at my school, was sort of deeply entrenched in conversations about substance use disorders amongst medical students and also mental health access and mental health treatment. And then found myself needing help myself and at the beginning of this year. And so sort of continued down a trajectory of needing to have conversations around mental health access and started working with Thomas along the way.
So let's transition into that KevinMD article, The Mental Health Jeopardy of Our Youngest Healers. Now, Mattie, I was wondering if you could walk my audience through that article for those who haven't read it and maybe kind of share the story of why you and Thomas decided to co-write it.
Of course. So this article was actually published as a part of Suicide Prevention Month, which is part of the American Medical Student Association's programming. It's a month that's organized by our Wellness and Student Life Action Committee, which is headed actually by Thomas. And we were talking a little bit about sort of how to get the message out that medical students and healthcare professional trainees sort of need access to mental health care. And I shared my story with Thomas, which I included in this article as well, that I was actually hospitalized for psychiatric evaluation just at the close of my major clinical year, my clinical rotation year. And so we open up our article talking a little bit about that experience that I had, and then we sort of broaden that out to talk about some of the different underlying causes of why this isn't just my own story, but a story of so many medical students who require mental health care and require specifically treatment for suicide prevention. So we speak a little bit about the issues around COVID-19 specifically, that exacerbation for many of mental health issues. We speak a little bit about concerns about residency applications, and we speak a little bit about the crushing medical debt that so many students are facing. And so those are just a couple of the structural issues that exacerbate the problems that medical students and future healthcare professionals face. And that's a little bit about what we talked about. And we sort of end with a discussion of why we think that Suicide Prevention Month through the American Medical Student Association is so important.
Thomas, can you give some specific examples of some of the mental health issues that you personally have seen other medical students face?
As I mentioned with my own story, burnout is surprisingly common. One study, 2008, said 50% of students experience symptoms of burnout. And so I see that so much in my medical student friends, especially during like the first year, like before you start med school, there's so much excitement and like a lot of energy, but by the winter or by the end of your first year, I see a lot of students tend to be a lot more withdrawn and tend to not socialize as much. And that's sort of at like a general base level. And then I've seen other students where they really struggled. I've had friends who had addiction issues and they would turn to drugs to try to help cope with these issues. Or I had other friends who like honestly were experiencing similar to what Mattie had with the suicidal ideation. In that same study, 2008, 10% of students experienced suicidal ideation. And it's really scary to see that. And I mean, again, as noted, it just really highlights like what more can be done. Can we help like destigmatize mental illness? Can we really work to let them know that it's okay to feel that you're struggling and to be able to ask for help?
And Thomas, in these students that you've seen these symptoms, whether they're withdrawn, depressed, did they recognize that they were being burnt out? And did they go and seek help?
It has gotten a lot better. We've had talks, sessions where we say like, where we had older classmates say, we've been burned out, this is what's happened. But for a lot of students, especially med students, they have like this notion that like, oh, it won't affect me, I'm better than this. Mental health isn't going to affect me. Or they have this other thing when they start performing low or they have this lack of concentration. Sometimes they tend to either blame themselves or they try to compensate with something else like drugs.
And Mattie, you open up your article with a powerful story of how you were hospitalized. Can you share how did that change you as a medical student after that ordeal?
Well, I have to go back to something that Thomas actually said, that as a medical student, you kind of hear these stories, but you don't imagine that they could happen to you. And so I was involved with advocacy around mental health access, mental health treatment access, but couldn't imagine that I would actually require that help myself. And so I think more than anything, my experience was really humbling, sort of realizing that, you know, in really difficult times, under really difficult circumstances, it's okay to ask for help. It's okay to lean on the people around you. And if you need it, it's okay to also receive sort of professional help as well, if that's what's troubling you. So I think humbling, that's one. And I would also say this sounds potentially a little strange, but it's felt a lot like a driver. My experience when I was in the hospital, interacting with other patients and being a patient myself, sort of recognizing that my capacity to move through this very difficult healthcare system is at least partially based off of the fact that I'm in training and that I have had a huge number of resources and opportunities that a lot of my fellow patients when I was hospitalized didn't have. And so sort of that experience and being a patient myself pushes me to want to continue to advocate for other patients. I guess, so there's the drive that I just mentioned, but there's also sort of a feeling of empathy or a feeling of connection, because it's not as though a patient can be separated from myself as a future physician. I am a patient myself, and therefore have a deep, intimate relationship with that sort of illness narrative, and that connection to needing help and receiving help when needed.
And Mattie, as part of the American Medical Student Association, you talk to medical students across the country. Now, is medical student burnout and mental health issues in medical students, is that universally recognized by most medical schools? And where are we in terms of support for these medical students across the country?
Yeah, absolutely. That's a great question. I can at least say that it's getting much better. There are large organizations such as the American Medical Student Association who are recognizing that wellness is important, that mental health care is important for medical students, and sort of the Wellness and Student Life Action Committee is a perfect example and testament to that. There isn't a unified effort, however, where I can say every medical school across the country is having conversations and caring for our youngest healers in that way. So unfortunately, I can't say that there's a nationwide initiative to support mental health care access for future physicians. There are initiatives, there are efforts underway to increase knowledge and increase access to mental health care services. One example that I can think of is the film Do No Harm, which is a documentary sort of depicting the issues that we're talking about here amongst medical students across the country. So there are efforts underway to sort of increase the conversation, but I can't say that we've really nailed it down. There's still a lot of work that needs to be done in actually setting up support systems for medical students and for future healthcare professionals. And that's some of the work that we're doing at AMSA and some of the work that I think Thomas and I can speak to as well.
And Thomas, if I was a medical student and started to have symptoms that may be due to burnout, what kind of advice can you give me and what kind of resources can you advise me to turn to?
So what I like to impart on medical students, and I'm an MD PhD student, so I've been around for like 7-8 years, is really to take a check into yourself, look into yourself and find things that really matter to you, things that you value, things that you're grateful for. And if you do find that you're having difficulty enjoying things that you usually do, struggling, really reach out, build up a community. It's okay to ask for help. It's okay to ask questions. You don't need to put on this facade that everything is going to be okay. There's a famous quote about like, if you ask a question, you look like a fool for a minute. But if you don't ask that question, you're a fool for a lifetime. And that runs similarly to help. If you don't get that help, that's something that's going to bury with you. And as Mattie was alluding to, there are a lot of med schools that have initiatives in place working to destigmatize mental illness. They have maybe their own counselors. Highly recommend just even visiting, saying hi, just so that they know who you are, and just being there, it's okay to be vulnerable.
We're talking to Thomas Pack and Mattie Renn. They are medical students and they co-wrote the KevinMD article, The Mental Health Jeopardy of Our Youngest Healers. Thomas, on a policy standpoint, what ideally needs to be done? What are medical students not doing that they should be doing to address this issue?
From a policy standpoint, there are system issues, and then there are also more local university issues. And what we're trying to advocate for nationwide is to really get two main stressors, I feel, that underlie medical student stress. One is the limited number of residency spots, how competitive residency is. And that's something that has been advocated to increase the number of residency spots. Because if you're worried that you're going to match, then that makes everything else more stressful. It's hard to create friends, hard to like do things that you feel like are cathartic for you, because you're like, I need to study for this test, or I need to like do these specific extracurriculars that'll get me into residency. So working on making the residency process better, more holistic. And second, really also fighting against these ridiculous debt that medical students have to have. Like the average student debt is nearing $200,000. Yes, if you graduate med school and match into residency, like you'll be able to pay that off. But that fear that you can't make it, and I have had friends who had to drop out of medical school and they have these like 100,000 plus debt. That's a very scary thought.
So I'm going to end with asking you both of you the same questions, your take-home message for the KevinMD audience. Mattie, let's start with you.
It's actually pretty simple, to be honest. It's that it's okay to ask for help. I think that we've talked about that over the course of this conversation. But if you are a medical student or a physician for that matter. If you find yourself experiencing mental health problems, the most important thing to do is to lean on those around you and to ask for help, and to not be afraid to do that, because it shows a remarkable amount of strength to recognize when things aren't going right and when something needs to change.
And Thomas, what is your take-home message that you want to leave with the Kevin MD audience?
I'd like to end this with kindness. Even with like medical students, anything that we experience, a physician taking the time to say, how are you doing? Show us the procedure, show thought. Kindness is so important. No act of kindness, no matter how small, is ever wasted.
Mattie and Thomas, thank you so much for your time and insight. And thanks again for being on the show.
Thank you very much for having us.